about the heart monitors that are needed, the pulse oximetry, the capnography, the blood pressure. All of these things need to be constantly monitored because we know from every expert, called by the defense or the people, that bad things can happen quickly when you're using propofol. Propofol is a wonderful drug if used appropriately. Bad things can happen quickly. Respiratory depression and death. If you don't know what you're doing and you're not in the appropriate setting with the appropriate equipment. This is criminal negligence. Immediate access and the ability to use resuscitative equipment. This includes the drugs, the crash cart, defibrillator, suction apparatus, as well as the airway equipment that paramedic Blunt was able to utilize. You don't just need to have it, you need to be able to use it. And I reference that being the ambu bag laying on the floor, which Conrad Murray never makes any mention of using. We know from the Seacoast records it hadn't even been ordered until some time, I believe in June, but you have the records back in the deliberation room. But he says he went straight to compressions and mouth to mouth, never once mentioning the ambu bag. No suction apparatus, no crash cart with the necessary drugs, no automatic defibrillator, none of the airway equipment one would need and require in order to safely manage an emergency as a result of propofol. This clearly is criminal gross negligence and extreme deviation from the standard of care. It requires continuous presence and monitoring. Abandonment of a patient, including just preoccupation with phone calls, texts, and emails, is abandonment of a patient. Leaving the room is obviously even worse. But you need constant visual observation of your patient. You do not leave your patient alone in this condition. There's a fundamental principle. If your concern is the patient's life, you do not leave them alone. That's why in the hospital setting we learn they have the backup personnel, all the audible equipment, all the equipment available, including people, including eyes on the patient, because bad things happen very, very quickly. Extreme criminal gross negligence. The contributory factor of the benzodiazepines. Again, in this setting, this only heightened the danger. In a hospital setting, you may be able to use benzodiazepines and propofol, but in this setting, everything is exacerbated. Everything is heightened. The risk of respiratory failure is heightened because the benzodiazepines are already working. They're already in the blood. Dr. White talked about all these variables. The reason you take the precautions you take is because you can't always predict how an individual patient will react. You can't always predict exactly how dehydrated that patient is. You can't always predict exactly the level of the benzodiazepines at a given moment. As the defense spent a great time explaining, there are variables. That is why you take the precautions you do. You don't have time to go back after the fact to say, you know what? I should have had that emergency equipment there. It's too late. Michael's dead. You take the precautions up front if you put the patient first. This, in and of itself, was an extreme violation, and the coroner found contributed to his death. The contributory benzodiazepine effect that exacerbated the propofol. Written informed consent, again, required to explain to the patient the risks involved and the benefits involved, the risks and the complications that may ensue is criminal negligence. Charting and documenting all vital records. Again, there wouldn't be so many theories about exactly what happened behind closed doors if it had simply been documented. Conrad Murray was all too willing to record Michael Jackson on May 10th on his iPhone, but not a single piece of paper documenting the dosages, the vital signs, the amount of propofol, the times propofol was given, the times the lorazepam or midazolam or Valium was given. Not one piece of paper. And think about that, because there were medical records for prior time periods. Conrad Murray did have medical records for Michael Jackson in 06 or 07 or 08. He was willing to chart medical records. He was capable of charting medical records. He chose not to keep medical records because he didn't want to document this pharmaceutical experiment he was conducting. And that is what it was. There was no precedence for this. There was no literature to support this. There is a lack of medical records because Conrad Murray chose there to be a lack of medical records, because he did not want to document what he was doing to Mr. Jackson. If nothing else, it reflects on the consciousness of guilt, the knowledge of Conrad Murray of what he was doing to Michael Jackson in this bizarre treatment. But it is criminal negligence either way. The 911 call. Again, you learn this as children. This is basic common sense. The first thing you do. Now, Conrad Murray, as a doctor, should have assessed the patient. He should have quickly assessed the patient, seen what's going on, and called 911. We know he's capable of making a phone call. If he wants to say it was, he couldn't do it at the same time, then you put it on speakerphone. But we know at 12:12 he made a phone call and did not ask for 911. This is bizarre behavior from anyone, let alone a doctor. This extreme criminal negligence. We talked about the doctor-patient relationship and how this was not a doctor-patient relationship. This was an employer-employee relationship. And that fundamental corruption of that relationship forms the foundation of every single act that Conrad Murray took, because he was not acting as a doctor with Michael's best interests at heart. He was not acting as an informed medical doctor trying to put his patient first. He deceived the paramedics. Again, that relates to the consciousness of guilt, but it's criminal negligence. It's unethical. It's unconscionable. He deceived UCLA medical personnel. Again, it's consciousness of guilt, but it's also unethical, unconscionable, and an extreme deviation from the standard of care. Now, we heard also about these simulations. And I want to talk about this briefly. You heard from Dr. Steve Schaefer, one of the premier experts in computer modeling and computer simulations. And there is some speculation as to what transpired, because we have no medical records. Michael Jackson is dead. So working backwards, Dr. Schaefer tried to piece together the most likely scenario based on the science, based on the prior conduct of Conrad Murray, based on the evidence recovered at the scene, and in Dr. Schaefer's expert opinion, who is well published in pharmacokinetics and pharmacodynamics, anesthesiologist at Columbia University, just received a lifetime award in his field. Based on the blood levels and all the available evidence, the most likely scenario to him is that an infusion was running. Nothing extraordinary or unusual about that. That is what Conrad Murray said he had done nearly every night for the past 2 months. An infusion was running.